US govt spend more than $1 trillion on healthcare in 1 year. So how come it's still very expensive? Congress will do everything except make it free. Medicare is purposefully insufficient so that insurance companies can still market additional coverage plans to seniors. They are also limited in how they can negotiate prices so they don't hurt profits too much. Medicaid is a mess that's funded by the federal government, but operated by state governments. So what it does and who qualifies depends on what state you live in. Many answers, but spending $1 trillion in a thing when you were just one customer doesn't tend to make it cheaper. Quite the opposite. Think about this. It is cheaper for those on Medicaid or Medicare what the gov is mostly paying for. It's not cheaper for those not on those plans. For-profit healthcare, massive administration costs due to needing to constantly fight insurance providers on things, etc. Basically, if private insurance either wasn't a thing or had to compete with robust universal healthcare which would fund everything, because instead of practicing medicine without a license it trusts doctors to actually know what procedures or medicines are necessary, we'd have better health outcomes and less expensive stuff. But that wouldn't make private health insurance all the money, so they lobby against it. Because it's privatized and we did not spend $1 trillion on healthcare, we spent $1 trillion paying companies that provide healthcare and insurance for healthcare for the purpose of making a profit. It's so expensive because the insurance company middlemen need to make profits, and they need to make more than the last year at the expense of the citizens of this country. The money goes into the pockets of the CEOs and board members of the insurance companies. 1 billion divided by 330 million citizens adds to about 3,000 person. That's 1 day in a hospital bed, or a ride from the ambulance. Greed, selfishness, lack of leadership. Part of the problem with Medicare and Medicaid is that they are not universal, so they are means tested. There is a huge amount of money wasted on administrative costs to find out if people qualify for the program, and in the case of Medicaid, to keep checking that they still qualify. That money could be spent in actual healthcare if it was universal. That's only one facet of the waste. They are also set up in most places to pay insurance companies to manage the healthcare instead of reimbursing providers directly, so that's another layer of people skimming. Because the right to profit while not in the Constitution is the most important right in America. People have answered the direct why question, but I have another one for OP. Why does spending on healthcare equals more healthy people? The government spends money mainly to reimburse procedures and medicine. If more people get sick, or salaries go up, or drug costs are higher than other countries, then the price goes up. The vast majority of this money isn't spent on RD to stop people from getting sick. It's reactionary. There are two main culprits to why American healthcare is so expensive. The first is just the sheer size of the American populations. $1 trillion accounts for less than $3,000 per person per year. That would actually be a great deal. The second reason is profits. The problem is we don't spend $1 trillion, we spend around $4.5 trillion annually. Every year the US spends about $12,000 per person on healthcare, while right across the border Canadians spend about $7,000. The difference is the profit for a very bloated privately run healthcare system we have in the United States. Lawsuits for malpractice and the costs of insurance against those lawsuits are a big cost. Doctors are not perfect and everyone doesn't get a 100% successful outcome. Someone gets 80-90 and then sues for malpractice. Because they didn't get 100, the doctor and his insurance settle the case rather than spend a ton of time and money proving they did the best possible. So that encourages others to sue to get some of that money being handed out. It's legal fraud, but it's billions of costs. Yes, there are bad docs out there, but they are hard to find out as hospitals CYA for them, as they would also be liable for damages by letting the doc continue to practice. Inflation and prices of equipment and supplies add costs. More and more high-tech adds costs. More tests and diagnostics add costs. Part of this is CYA by docs against malpractice and are not absolutely needed. Also, the US population is getting older, and older usually means more healthcare is needed. It all adds up. Your first mistake is read a tweet. Because the money goes into the pockets of insurance and pharmaceutical companies, they double dip remorselessly and the taxpayers fund it all. The US has Medicare for the retired and over 62-ish that no longer work, so they can't get healthcare through work. They have Medicaid for those in poverty. There is too many people making stupid money that shouldn't be in the chain of care. Not in the USA, but in general, medical equipment and procedures are very expensive. Think about a simple surgery. You need minimum a team of 4 people. Add more for a more complex procedure. An MRI machine costs between $1-3 million, and basically every hospital has at least one. And that is just one thing. Each hospital is filled with expensive equipment. Part of it is that the government doesn't have a singular insurance system to negotiate prices with pharmaceutical companies, so there's less leverage to keep costs down compared to countries with single-payer care. The prices for medical treatment keep going up, but the quality of care doesn't keep pace.